Hi everyone, welcome to OET 369. I'm really glad to see you all after a short break. Many of them have been messaging me asking, where am I? I'm still here and we'll be continuing to do videos on a regular basis from here onwards. Okay, so in today's agenda, we are going to discuss an OET writing task for nurses. So today we'll see in this video, we'll see how to or select information when you write and how to organize your case notes and paraphrase it in a complicated case note. And I think we'll also provide a sample letter at the end of this video. So hoping that this would, this will be useful for all of the OET aspirants who are trying to prepare for their exams. Before going to that, I would like to answer a common question that I usually come across these days. Many have asked me, or many of the OET and IELTS aspirants have been asking me, actually, I don't feel very comfortable to communicate. I'm not very confident to communicate in a group, or I'm not confident when I try to speak something in English. And they've all been asking me, how can I overcome these problems? And I think most of the candidates who speak in a, especially in a non-English speaking country, may come across this problem, which is quite natural. Because if you're doing a different first language, or if you're routinely using your first language, or if you're routinely using any other languages, that means your English communication may not be that confident. You may not be able to do that with confidence. So the answer to this question, I think my first suggestion is try to improve the opportunities to communicate in English. And the first and foremost thing I would recommend you to do is communicate in English with your trainer. Okay, so many of them have been asking me, you're from Kerala, or you're from Tamil Nadu, or you're from Andhra Pradesh. Why don't you do English? Why don't you, your videos in local language? Well, actually, I thought if I'm an OET trainer, I should be speaking to you, or I should be communicating to you in English. That's what our agenda should be. So, if a trainer communicates to you in English, if you live in a non-English speaking country, that is the only time you get to communicate. So, it's very important that your trainer should teach you in English and you should reply to them in English too. Not just when you do speaking role plays. So we don't encourage that practice. So I would strongly recommend you to listen to OET classes and IELTS classes in English language. Okay, that will give you a confidence to speak, and that will boost your confidence, and that will give you an opportunity to try out your things as well. Whereas if you keep listening to them in Malayalam, Hindi, or Tamil, that means you're only listening to that language again, or listening to your own first language again, which may not, give you a chance to listen to English or speak in English. Okay, so this is my, strong advice to you all if you are struggling to speak or communicate. Okay, so let's go to today's writing task actually. So what we will do is I'll show you the writing task and I'll show you each of the case notes part by part. We will discuss whether this is relevant or not relevant. We will also discuss how you can actually put that in your case note or transform to proper sentences. And as I said, we'll also try to give you a sample letter. Okay, so today's writing task, let's read that first. You are the community mental health nurse. Write a referral letter to Dr. Adam Collins, 21A Stubbington Hospital, to assess this case and to provide further assistance. Okay, so here you are saying, so you need to analyze the basic things from here before you go to the next of the case, before you go to the rest of the case notes. So if you are doing a nursing writing task, you will always be a nurse. Here you are writing to a doctor, but you are not quite sure which specialty doctor that is. You are asking further assistance after the assessment of this particular patient's case. So this is a referral letter. You don't think this is a known case to the reader before, and you also know that you are writing to a doctor. So I have also read the management plan on the top, which is refer to psychiatrist for assessment and further management. So you know that you are writing a referral letter to a psychiatrist to provide further assistance and management. Okay. So now our aim is to go through the rest of the case notes. You need to see what is the patient's condition. You need to see how the patient, what are the major problems that patient came with, and what are the things that you may ask assistance to. Okay. So this is a patient called Claire Cooper. So patient history is given there. Claire Cooper, female, 28-year-old teacher. She has two children, 4-year-old and 10 months old. Both pregnancies and deliveries were normal. Her husband is a 30-year-old manager of a travel agency. She is living with husband's parents. She has, full history of schizophrenia and symptoms controlled by a drug called risperidone. No smoking, no alcoholism, no recreational drugs. So this is just a background about the patient. And remember, you are writing to a psychiatrist in this case. So her social background or the factors that may affect her psychologically should be a priority. So you should be using this patient history or background information, to communicate that to the psychiatrist so they know what the living situations are. Okay. So yes, that information should be relevant. I don't think I will mention that all this recreational drugs or smoking. I don't think I would say that in detail because she has no habit. If she has a habit, yes, then I can say she uses it. But otherwise, no. Then they have given 1, 2, 3 dates there. It's always a problem when you come across these letters with different dates. Students always struggle to paraphrase the information when their letters are given on the basis of dates. So you have to always see how these dates have come across. So you can see that a subjective and objective data on her visit on 10th and her what has the management done. You can see that subjective, objective and a tentative diagnosis and a management plan on 13th. You can also see on 16th again subjective, objective and a probable diagnosis and a management plan. Okay, so in here there are 3 dates. All the 3 dates you have a subjective data, which means what patient reports. You have an objective data, which means what were your findings. You have you have also 2 diagnoses in the last 2 visits. So here you need to see what are the things that you should include in this letter. Okay, so this is like a progress track of the patient. So you can't start from the recent thing. You should just give a background about what happened in the previous visits. Then only you can come to the present situation. Okay, so I would start this letter from 10th of the 8th, 2021 data. Okay, so you can just probably give a bit of background about this patient because that's also a good idea. But let us talk. So here you remember you're asking to manage this condition, to assess and to manage. It's a very common knowledge that if a doctor needs to manage a condition, they need to know what are the symptoms. They need to know what are the management other doctors or other nurses have done so far. So you should be clearly talking about all this in the previous visits. But I don't think you have to elaborate it so much. You should elaborate the current visit. So this is the most recent thing that she experiences. So let's see how we do this. Okay. So you can talk about the 10th. So the subjective data there is relevant. Objective data, appearance, normal, mood, she's not depressed, everything is normal. So I would eliminate that objective data. Management, you just advised to relax, start regular exercise and a temperature chart. If not happy, visit required. So here you should see, you can just say that she was complaining of tiredness on her visit on that date. And she was also, she had a lack of motivation to work and she had a low grade fever. I don't think you have to talk about the objective data. You can just say that she was, that's what her problems were because you haven't given any particular management in detail. So here in this first visit, I will just say about her symptoms that she presented on 10th. And, there is no particular management. There is nothing in objective data. So you can skip all that information. Okay, so now when you go to 13th of September, 13th of August 2021, again you can see she has previous symptoms, no change. She has poor concentration and attention to job activities, finding living with husband's parents difficult, says her mother-in-law is turning and her husband is against her. So you can see that she has aggravated her symptoms, okay, or she has more problems than she came in the initial visit. So I think it's a good idea to explain the symptoms that she had this time. So you can say that she has not shown any improvement or she did not show any improvement on the next review. You can say that she displayed, she had paranoid. Clearly, you can see that she has come up with the ideas of paranoid, which you have to mention. She has anxiety and all, which I would say clearly in this letter, because that those are her symptoms. Okay. So in the next visit also, I would say, um, feels anxiety, poor sleep, frequent headaches. So what she feels paranoid, I don't think you have to explain on what she is paranoid, because it's paranoid, it's not a factual thing. So here you just say that she represented, she didn't have any improvements. She had paranoid, you could say, feel that she was paranoid, and she had anxiety and a lack of sleep. Okay, so that's how you will say. And in the objective data, they are saying mood mildly depressed, little eye contact, speech normal, physical examination normal. So the only thing that you could mention here is she was mildly depressed, which I would probably say in my letter. And the tentative diagnosis early depression or schizophrenia. So I think I will say that too, because that's what we suspected in the second visit. Okay. Um, so you can also say what are the management that you have done. So you can say that she was started on diazepam, and we have also put a provisional diagnosis of so and so, and you can say that she was started on diazepam. Okay, so that would be your second visit. Okay, the important thing in these two visits, you need to take out the important management or important symptoms that she had, and then what is the important objective data you found, and what is the important management that you have done. Because they are previous visits, I don't think you have to explain each and everything in this letter. Okay, sorry, everything on that date. Now, last visit, I think I would say everything in this case, because subjective data here, she is accompanied by her husband, and he said that she tries to avoid eye contact, reduced speech output, impaired planning, visual hallucinations and delusions for the last 5 days. Objective data, you can see there are loads of objective data that you found. So mood depressed, little eye contact, speech disorganized. So you can put that. And she has a bizarre behavior, so strange behavior. So put that. Again, there is a probable diagnosis there and a management plan, which is what you are doing now. Okay, so in this visit, which is the most recent visit, you will explain that today she was accompanied by her husband in a depressed state. She was showing a little eye contact during visit. She had a strange behavior. She had disorganized speech, and you have done many management. So despite or in addition to the management, or even though you have done management, she has her symptoms is worsen, and she also has a 5-day history of reduced speech and visual hallucinations and delusions. So you should give a complete picture about the last visit here, because that is how that is the recent thing. So you need to highlight on that part. Okay, and then you can say that she has family history of schizophrenia. Just give a little bit background about that teacher children and her family background. Okay, so now let us see how have you actually done this case. So in general, if you say you need to say background about information about the patient, the first two visits, whatever is important that you have highlighted and said, and in the last visit, which is the most recent visit, you have highlighted everything because it is recent, everything is important there. So I think you have to elaborate on that last visit. So remember, for any visits with different dates on, you need to focus on the most recent visit. The last or the previous visits, you only need to say if that is related to the current problem, and you only need to say the important things that you have found or important management that you have done. Okay, I am now giving you a sample letter, so you can have a look at a sample letter at the end of this video and see how you have actually transformed this into case notes. Okay, so yes, so you were writing to a psychiatrist, so you have explained everything. If this was a discharge letter, maybe you wouldn't have explained so much, which we will discuss in the coming videos. Okay. So I hope this video was useful to all of you, who are preparing for the writing module. If you have any queries about our online coaching, please log on to our website, english369.uk, or you can WhatsApp. I have included my WhatsApp number with the description, so please WhatsApp to that number. You can also email me at oit369@gmail.com if you have any formal queries. Now, I think that's all I wanted to tell you all today. Good luck for all of you who are preparing for your next OET exam. I'm sure that if you are preparing very well with a better training and with better communication opportunities, you should be fine in your exams. I really wish good luck to all of you. We will be coming back shortly with new videos, new speaking modules, new writing case notes. So please do keep an eye on our new videos that is being uploaded. Thank you so much, and thank you for all of your support. Keep on watching OET 369. Bye bye.